available to specialists and doctors at cash rates. I am extremely proud and grateful for all of you showing up tonight. I want to thank the partners tonight that make this night possible, namely my team, Shankx Web Development, my co-founder of the chapter and his team, Dr. Moczygemba and RedMed Clinic, the Hubner Ambulatory Surgery Center, CorePath, Altiqe Consulting, and everybody who I might have forgotten right now. I also want to thank my guests here tonight, Constable Kathryn, thank you for coming. I know you are a breast cancer survivor and you fight a lot to drive for advocacy and give access to early screenings. So I think tonight you will learn that a lot can be done to make healthcare and early detection accessible based on free market principles. A while back I was traveling and I was in Chicago and I spoke to a young cardiologist and I told him about the free market surgery centers, and it was very odd because somehow I felt a lot of pushback. This guy saw me as someone who I'm not sure wanted to destroy his career or was against him, but that is not at all the case. Not at all. We don't want to destroy medicine. We want to bring back what it originally meant to be, which is doctors, physicians, surgeons, nurses, pharmacists, and anyone else I'm forgetting. Give them the chance again to really offer health care at an affordable rate and in accessible ways. And that is something we can absolutely achieve through American ingenuity, which is truly what FMA is, in my opinion. And my role really is just to get to know all of you and simplify the message a little bit so that the general public can benefit from all this valuable information. At this point, I want to give the lectern to the chapter co-leader, Dr. Moczygemba, so that he can speak a few words to us. Dr. Moczygemba.
Thank you, Shankar, so much. I want to echo what Shankar said. Well, first of all, I want to thank him for the great effort that he puts forth to put these meetings together. It's a pleasure for me to work with him. He truly has his heart in what he does in his business, and also with me in trying to create this free market in healthcare in San Antonio. Like he was saying, we're very excited. It seems like every meeting we have, we seem to get a little bit more traction, and things just keep coming together slowly, but they're coming together. And so tonight we're really excited to be at a place to talk about having a free market surgery center in San Antonio. You know, the whole purpose of what we're doing here is try to create affordable and accessible health care, which is kind of hard to find these days. But you know, when you step back and just break it down into individual components, like I tell people, I went to medical school
trained on how to take care of people, and that's what I do. So if you're a patient, I'm a doctor, I can take care of you, and we can do that at an affordable way. It gets really expensive when we get too many third parties involved, and especially if they get a little too greedy. Okay, so if we break it down to the basics, that's what we're doing here. Okay, so we want to just take that to the next level now, from doctor-patient, company, clinic, to getting more specialists involved, and then having the free market surgery center in San Antonio, the Hubner Surgery Center. Okay, they're stepping up to the plate and offering to be that facility. Okay, so we're so excited about that. So the other thing I want to mention is that we always want these meetings to be very practical. We've had some wonderful speakers here. We have some wonderful speakers tonight, but the purpose is not to come out and listen to a pretty speech. We want you to be thinking of how this can help you as an individual, your company, or how, if you're a healthcare provider or a facility, how you can help us grow this or create this value in healthcare. So the whole purpose is practical. We want this to work, and we have some key players here in this room tonight and at all of these meetings to make this work. It's got to be, I can't do it by myself, and it's not all about me anyway. It's about creating this value in San Antonio. So maybe I could just do this real quick. If you're a provider or on the provider side, a facility or a lab, please stand up. Okay. I was waiting for you to stand up. Thank you. So there you go. Have a seat. Okay, if you're on the employer side, please stand up. Yes. All right. Other employers? Thank you. On the broker side? Okay, thank you. So you see, we have key components in the room. We've got the employers who purchase healthcare, we've got the providers, and then with a large organization, we've got to have the brokers involved to help make it, to customize it sort of to the employers and to make it all ACA compliant. So we're very excited to have this meeting tonight. So I will turn the time over. Oh, the other thing I wanted to say, I'll ask the speakers to try to stay on time, so we have plenty of time at the end for questions. Okay? Thank you, Shankar.
Okay, the joys of being a speaker and technologist, I can tell you, that is always great, whether you know what you're doing. And we have Honorable County Clerk, Ms. Lucy Adame-Clark, coming in. Thank you so much for making it. Next, we have our speaker, Dr. Ehsan, Aamir, and Curtis Luce. Are you going to speak together? Dr. Ehsan, okay. I asked him earlier, well, what is it what you do? Again, in layman's terms, they help pathology labs make sure that what they measure in-house is correct by providing a reference lab. And these things, these small details are very important for a free market to keep overall costs of specialists low. Dr. Ehsan, thank you so much. We'll bring up your PowerPoint now. And here is your quick.
Good evening, honorable guest. Thank you, Shankar and the team, and Dr. Moczygemba for the invitation. It's a pleasure to be here as a pathologist, and I have a very brief presentation which is kind of sync with the philosophy of FMMA and the surgery center and what happened as a bundle payment in the process. So if I may have the presentation up. So CorePath is a laboratory in town in San Antonio, and I'm the founder and medical director of CorePath. I'm board-certified pathologist and subspecialized in hematopathology and molecular genetics. I moved to San Antonio when the 1604 was a gravel road back in mid-90s from the East Coast, and I was told not to go there because it's a death loop, right? So I enjoyed my stay since then. I have two boys who have grown up. One of them is going to be a physician from Houston and Baylor, and the second one is UT Austin doing a PR kind of thing. I joined as a faculty pathologist, I was very passionate about teaching, and being an academician, want to learn and transfer the knowledge that we can give to the next generation. So about 12 years into the academia, there was limited opportunity for me to grow, to think outside the box, more kind of innovative approach. So I took the very bold step as a single person, starting a CorePath, and founded it in 2009. I knew the easiest thing for me is to practice medicine, and the challenging thing is rest of the stuff that we just talked about. Since then, the journey has been fascinating. There were three basic goals in my mind at that time. One was physicians, providers need to be more entrepreneur, need to think outside the box and grow. We would like to grow not only in San Antonio, but nationally and internationally. And since then, we have grown into 20 different states and a couple of other countries as well. The second goal was collaboration like this, collaboration with a lot of academic centers and collaboration with just anything that we don't see right now. And the third thing was more innovative, as we are seeing that the artificial intelligence and genetics and how the whole landscaping has been changed. So that was basically the purpose of CorePath. Couple of stories here. I talked to Dr. Smith a few months ago. Curtis received a phone call from him that we have a patient who would like to have a bone marrow procedure done. What would be the cost? That was a very unknown big question because there are so many testing involved. The patient was from Canada, not from US, and Curtis called me, and based on the clinical history, I gave a fair market price. I told Dr. Smith that this is the price that we have, and this is not in Canadian dollars, this is in US dollars. So anyway, one of the things that we built was the EMR, or the lab information system, and this is what I have back then in mind, that we might be seeing patients from anywhere other than the US, so your EMR should not be focused on social security number to take the patient, right? So here is a good example of a patient coming from a different country and requested the test that I, based on the clinical history, gave my numbers. The second call I received was from a cancer patient and said that CorePath is doing limited tests, only 26 markers. I don't want to go into the detail, but the other facility has done 48 markers. You might be missing my cancer. So this was a mindset that has been commercialized in insurance companies and other places. So I gave my valid reason that more does not mean better, and less does not mean low quality. The personalized medicine has been missing, focusing on the particular need of the patient. So those were kind of two interesting stories that nicely sync with the philosophy of FFMA and how the pathology perspective can play a role there. Who are pathologists, and what do we do? Pathology is actually two components, the clinical lab, where all the blood tests and urine tests are done. And other most important thing is the tissue diagnosis. When you have any tissue taken out in the surgery center, you send it to the pathologist, and then the whole world is there to make an accurate diagnosis, whether it's a breast cancer, a leukemia, lymphoma, and thyroid cancer, and you name it, or prostate cancer. Pathologists are MDs or DOs. They went to go through the medical school, and they have a very detailed 4 to 6 years of formal ACGME fellowship training and residency training. COVID is a good example, like what pathologists do and what lab does. We are invisible doctors. We are also called doctors, and we have been practicing social distancing since 1858. So that's why you don't know about pathologists there are. So this is my team here. They're very well qualified pathologists from exceptional academic centers and board certification in different disciplines, and that kind of give you a flavor of the breadth of the knowledge within the pathology. A very comprehensive, quick way of glancing the tissue diagnosis when a tissue, whether it's a breast, prostate, bone marrow, anything is taken out. These are the comprehensive testing that we do, which include flow cytometry, looking at the chromosomes, cytogenetics, looking at the fish, which is more like a probe, looking into the particular genes, looking at certain tumor cells with different markers, and the big one is the gene sequencing. All of them are being offered these days as a routine basis in any tissue-based diagnosis. We create the report which is more meaningful for patients coming from different kind of aspects. What does it mean? Pathology is not only pathology. Pathology is actually a laboratory medicine. Pathologists are laboratory consultant. If you look around and see the practice of medicine, whatever you do, 80% of the clinical decisions are made on pathology report or pathology result. And these lab results, whether you have a cancer or no cancer, it's very important to screen them, as we know that in any cancer, screening is really the key. Pathology results are also for diagnosis, if you are obtaining a tissue, of course. Treatment, important treatment decisions are being made, and prognosis, how the patient is going to be performing based on different studies that we do. I was talking to one of the breast cancer survivors just last week, and she had like 3 recurrences, and she's still a survivor, fortunately. And she was saying that the most satisfying thing for her was looking at her own cancer cells with the pathologist from the common man perspective. Pathology report need to be accurate. It need to be precise. It need to be timely. Even if the patient is 1 day waiting, that a lot of cost to the healthcare. And it need to be very meaningful and personalized, which we have been missing, these days, the true value of personalized medicine. This is really the key slide here. I put together the common procedures that are being done in the surgery center and how this can be compared national average for the hospitals and what we do at CorePath, again, taking into account the personalized care. And the numbers speaks for themselves. You can just pick any random tissue diagnosis or tissue, whether a GI biopsy. Since my specialty is more into the bone marrow, I can walk you through the bone marrow without just the bone marrow biopsy itself. In a hospital-based setting, the number is above 2,000, and CorePath, done by pathologists, it can be so low, significant cost saving. Bone marrow without genetics, huge. I mean, that's unbelievable. We have seen patients getting all these kind of surprise bill through the hospital for pathology-only related work. And we offer a very personalized care. That's the reason I gave example of that particular patient that called me. With genetics is becoming very common these days for any kind of cancer. Our cost is still way lower than what rest of the hospital charges. So this model of surgery center and a bundle payment with a pathology based on the history and based on the tissue obtained can be very, very efficient in terms of cost savings. We continue to have academic affiliation. We have teaching affiliation with MD Anderson Cancer Center. We are also having faculty appointment of our pathologists with UIW, with University of Arizona, and of course with UT Health, as well as for technologists with St. Philip's. So one person that I started in 2009, we have grown to 100+ employees, including physicians and other non-physician employees. We'll be moving to a new facility in the beautiful hill country on I-10 in Cambolis, right where the La Cantera Mall is, and we are really excited to be there. So I'm happy to take any question at the end. I'm joined by Curtis Lewis, who's our executive VP for business operation. So he takes all the headache that is billing related or the price list related. My job is just to be the simple pathologist. Thank you.
Thank you so much, Dr. Ehsan. Next up is Randy Reynolds and Michelle Patino with the Hubner Ambulatory Surgery Center. And as I said, we're going to connect with Randy on Zoom. So we're a little bit early in the schedule, so we'll see if we can connect with him, and then we will continue the presentation.
Well, good evening. My name's Randy Reynolds. I'm the Senior VP of Development and Operations for HealthCrest Surgical Partners. My company manages Huebner Ambulatory Surgery Center. Michelle Patino, who is with you in person tonight, is the administrator of the facility. I don't know, Michelle, if you want to raise your hand. I have the privilege to work with her and her very experienced and competent staff. I've been working with them for the last 4 years. I do apologize for not being there in person. I had a board meeting. I'm actually in North Carolina, so again, I very much apologize. I wanted to be there, but I couldn't get out of the board meeting, so hopefully this will suffice at least for now. I want to thank the San Antonio chapter of FMMA for putting on this event and providing Michelle and I with the opportunity to share with you about our surgery center. I've been a member of FMMA for at least 6 or 7 years, very familiar with you know what you're trying to do, and very on board with it. You can go ahead and go to the next slide. You know, we all know healthcare costs are increasing every year. I mean, it's just a fact, and even in most cases, it's more than the cost of living increase. I'm really not sure what's going to happen this year with all the hyperinflation and labor shortages that are driving costs up. I mean, it's really going to be interesting to see where it all falls out at the end of the year. But I would anticipate additional increases are coming. And I know everybody's looking for solutions to this. You know, like I say, payers, employers, patients, providers, everybody's looking for a solution. And I feel like that Huebner Ambulatory Surgery Center understands the role that we can play in this to provide high quality surgical services in a low cost environment. So you want to go to the next slide. A little bit about Huebner or ASC. We're located just off of I-10 on Huebner Road. Easily accessible, obviously, from almost every direction, and as well as from air travel. I know that's sometimes important too, because we're only a short distance from the airport. If you want to go on to the next slide. We're located in the first floor of this building, which is at 9618 Huebner Road. We currently, if you want to go on to the next slide, we currently have 4 fully equipped ORs that handle various specialties, including bariatrics. And for that reason, you know, we have compensated for furniture and equipment that we feel like we can service pretty much any prospective patient. Here's our nurses station, and you can see the pre-op PACU bays in that same picture. And then in the other picture, we have one of our fully equipped ORs. We have the ability to have overnight stays. You know, we have rules, obviously, we have to follow. The patient can't be in the facility more than 23 hours and 59 minutes. And we do have some patients, especially some of our bariatric patients, that choose to spend the night. We do total joints as well. We pretty much have this down to a science. Most of those patients, if they're in by 9, they're out by 3 with the pain pump. And, you know, that's pretty much standard, I think, anymore for ASCs, but we do follow that protocol. And again, we would keep a patient overnight if needed, but in most cases they go home. And a lot of the bariatric patients, believe it or not, we'll put a sleeve in and they want to go home as well. So, like I said, we just have that ability if it's needed. Go ahead to the next slide. As I said, we're located at 9618 Huebner Road. We've been open since July of 2017. 4 ORs with 2 additional ORs under construction. Those will be finished. We're anticipating doing cases in those ORs in January. We have 21 physician partners, 10 specialties, and I'll have another slide to give a little more detail there, but we cover pretty much the spectrum of specialties, and we're in network with all major payers. Go ahead. Here are some doctors who are credentialed at our facility and their related specialties. Again, I said 10. You know, colorectal also, Dr. Winston also does GI. So, you know, that makes 10 specialties that we have there. Most of these doctors, not all of them, but most of them are partners as well. Go ahead, next slide. You know, organic growth is important for us. Obviously, you know, it's part of our budget process, it's part of our strategic plan. And we see 5 ways to do that. You know, obviously recruiting new partners and adding specialties, recruiting casual users. You know, those 3 all help, but we do see some opportunity in developing referral networks and pursuing bundle pricing arrangements. If you want to go to the next slide. The recruiting partners, you know, it kind of goes without saying. We try to identify doctors that are in the same specialties that we have. That way we're not out additional monies for equipment. So that's who we would focus on first. Although we have added some specialties in the last couple of years that have been lucrative to the center, but we always do a viability study to make sure that when we do add those specialties, that it's going to be profitable for the center. And again, casual users, a lot of times we'll have doctors that are within the specialties that we have that are looking for a place to work, that don't necessarily want to be a partner for whatever reason, and obviously we welcome them as well. So that's those 3. Now the other 2 prongs that we're talking about, if you'll go to the next slide, you know, referral network. I've always been a firm believer in this. I actually ran a center several years ago, and I built a huge referral network with primary care doctors, family practice, urgent care clinics. You know, now there's been, you know, there's the clinically integrated networks, the ACOs. Now there's TPAs. There's other things now that really weren't that prominent back when I was running my center, but there's a lot of opportunities here to drive referrals to low-cost providers, and we are one of those. So that's one of the prongs we work on as well. So next slide. Bundle pricing. I mean, I'm not telling you probably anything you don't know, but every year the number of self-funded plans increases as a percent of the total. I mean, you can go back probably 10 years ago even, and you know, most of the people that were in that space were your larger employers. I've gone to some FMMA meetings, and you know, there's people there with 70 employees that are doing self-funded plans. I mean, it's definitely moving in that direction. I think employers see a huge savings in going that route, and those are the opportunities that we see. You know, I've seen 2 different approaches here. One is more of like a bolt-on process where, you know, the company keeps their BUCA insurance and does a bolt-on on top with a TPA or directly with a provider. Then of course, there's others that have gone even and moved away from the BUCAs and basically done their own plan. And you know, again, we're open to work with anybody, and I'll actually be there next Tuesday if anyone would want to stop by the facility or even want me to stop by their office or something. I could do that then. Go ahead and go down the next one more. You know, San Antonio is a large, you know, I think it's in the top 10 cities in the country. And, you know, you've got, not only do you have the population of San Antonio, you know, you've got that area around it. And I apologize for the dollar signs. Actually, I corrected that. That's an error. But you understand it's 1.5 million and 2.6 million. It's a huge metropolitan area, and a large portion of that's employed, and your average age there is 34. So there's a lot of opportunities here for cases to be done, again, at a low-cost provider. So you want to go on to the next slide. I just listed on these next two slides a lot of the large employers. Y'all have several. So, but I know there's many more companies than this that are self-funded. So, again, I think the opportunities are endless. I do think we have an advantage over some of the other surgery centers because, because we're independent, we don't have maybe as much leverage as some of the other surgery centers that are owned or managed by some of the large management companies. And so, our contracts aren't as rich. And I think you would find us, our pricing reasonable, and we would work with you to take care of your patients. So I'll just open it up for questions. And unless, Michelle, do you have anything else you'd like to add?
Hi, my name is Robert Castaneda, and I own a blood, molecular, and diagnostic laboratory in San Antonio. I'd like to offer our services as part of your FMMA services at your surgical center. If you're going to be there next week, I'll come say hi. We can talk. Okay. Michelle obviously would be involved in that discussion as well, so okay. That'd be fine.
Hello, my name is Greg Caldwell. You said you wanted to pursue bundled surgeries, and yes. I'm curious if you have bundle pricing put together, or is that a one-off you're willing to put together, or if it's something you already have published?
Okay, that's an excellent question. We're in the process of putting a list together right now. I have visited with one of the brokers there in town, and we kind of talked about until that's all finalized, because we do have to work with the doctors, and the anesthesiologist to make sure everybody's in agreement with the payment.
Correct.
We can do, if somebody has a case, if you'll just bring that to Michelle. I don't know, Michelle, if you brought any cards, but we can price that out until that's done. We'll expedite that process, but like I say, we're working on it right now. Hopefully to have it done soon.
Okay, thank you.
Mm-hmm. I think you'll find us probably as competitive as you're going to find anywhere in town. I don't think you're going to find anybody's going to be cheaper. I know Keith Smith, I know his pricing. We would probably be a bit higher than that, but not ridiculous, no. That's the thing about, Keith. I love Keith. I know Keith really well. But obviously, the cost of living is a little bit higher there. Plus, anybody that would go up there is going to incur a lot of travel costs too. So, I think we would be more than even up on any deal that you brought to us.
Thank you so much for your presentation. I'm Dr. Barrera. I'm an ENT plastic surgeon in town. And a question for you. We have a surgery center that's specifically ENT and plastic surgery currently. We do offer free market bundled pricing for all our patients, but most of our patients, 90%, come in for cash pricing. So we're currently on this model. My question is really a reverse question, and that is, coming from your current book of business with insurance companies and contracts, how do you maintain two different pricing sheets, if you will? One that's contracted with insurance companies and have a specific price for the insurer and the employer, and then yet offer a separate bundled price for patients that are looking for free market services. How do you navigate the dichotomy in having two different pricing structures?
Well, I mean, you're really dealing with, in some respects, two different patients. I mean, we've always had a cash price. If somebody comes in, they don't have insurance, or they don't want to use their insurance, we always have had a cash price. Really, to me, this is just an expansion of that, where we're trying to coordinate with the doctor and the anesthesiologist to provide more of a complete package to the patient and again to the employer. As I said, our contracts are not as lucrative as some of the other ones. So, I mean, that's probably why you don't see a lot of ASCs playing in this space. Because they get, they're tied to hospital systems, so their contract rates are better. So they don't see this as being an opportunity. That answer your question, or? See there? I lost. I'm not hearing. So. Okay.
No, I appreciate your explanation. I think part of it is coming from a free market perspective already, and yet I'm actually looking to see whether we want to play in the insurance space. So I think it's a dichotomy to manage both, right? Because once you have your contract set, you know what your pricing structure is and what your costs are, and then now you're offering a bundled price, which may be more competitive. We're actually coming from a different perspective, and that is we already have a competitive bundled price, and yet we're looking into moving forward with insurance contracts. And so we're sort of coming from both opposite directions, if you will. So I'm glad that you were able to share your experience with that.
Well, one thing you can think about too, if there's any employers there today, is even if the person used their regular insurance, we're still going to be cheaper. So, if somebody has Blue Cross or United or Aetna or Cigna, if they come, even if they come with the bundle or with their regular insurance, they're still going to save money. So, I mean, I think it's a win-win. I don't, moving to the point Keith is, he's miles ahead of everybody else as far as, I don't even know if he even takes insurance anymore. We're not in a position to do that. We live off of our insurance. But I do think there's opportunities here through bundles to take care of some patients that right now that business is going other places. And we'd like to be in that space. So that's why we're here.
Do you want to maybe explain why we are always going to be more cost effective and will always be the cheaper choice, even if it is compared to another ASC and definitely compared to the hospital systems?
Yeah,
that might be a good
systems,
approach.
Yeah, I had a slide in there. We get paid about a third what the hospital systems do. On commercial, we get paid 52 cents on the dollar for Medicare. And I would say probably any ASC that's hospital affiliated is leveraging their contracts, so they're probably getting close to twice as much as we are. So, as Michelle said, we're still making money. I mean, but we have to run very efficiently, and Michelle does a great job with that. And I'll tell you another thing, we've got a staff that loves to work at Aamir ASC, and they love to take care of the patients. And we have high, very high patient satisfaction scores. We're very focused on quality. You know, just because we're the low-cost provider, you know, doesn't mean that the patient's going to get less quality or less care, because you know, that's not how we do business.
Okay, our next speaker, Allison de Paoli. People like her, consultants, who really understand what the free market is and how health insurance works, they are key to driving our mission. Why? Because everyone who's looking for healthcare and think that healthcare equals health insurance, even though that is not always true, they will go and talk to someone like Allison or Kelly Pickett here with Harlan Pickett Health Insurance. The key is that these people are important because they are the bridge between the end consumer and healthcare. And it's rare to find consultants that understand that by helping their customer, they're doing the right thing. You know, when it comes to an individual and they need to shop for health insurance, that is one thing. But once you get to shopping for health benefits for your small business or even larger business, then it gets complicated. You have to make sure that your workforce gets the medication they need, the imaging they need, the surgeries they need. There's a need for something called TPA, third-party administrator, which for the longest time I didn't understand what that is, but Allison understands that very well. And she understands how all the different building blocks can fit together to drive free market principles and make those a viable solution, not only for individuals, but also for larger companies, employers, and to make it worth everyone's while. This is not about taking anything away from anyone. This is about not having greed in helping people, employers, and employees, and vendors. Ladies and gentlemen, Allison de Paoli, the DPO.
I might be a little frightened after that introduction. And I'm really bad with technology. So, we're going to have a quick agenda. It's not nearly as scary as it looks. So, item number 1, if we are going to survive, we need to all evolve and adapt. The US healthcare system is coming apart in pieces. I'm not the only advisor, broker, consultant who thinks that. I think most of the providers in here think that. The employers that I talk to think that. It's working very well for some people. Unfortunately, those people are not employers or patients. So what I do is one thing. I unbundle and rebuild health plans. And what we try to do, and sometimes we build the bridge as we go, is provide solutions that are completely transparent and allow an employer complete control. Right now, employers do not have control. They have no idea what things cost. They have no idea of the quality of their providers. They are told it's basically none of your business, which I think if you pay the bill probably isn't true, but okay. So the result of unbundling and rebundling those things is full control of the healthcare supply chain, right? A healthcare plan is not one thing. It's drugs, it's doctor services, it's imaging, it's lab, it's PT, it's durable medical equipment, it's hospitals, right? So you need all of those things. And you need high quality, all of those things. I think we can all agree that quality is the #1 predictor of outcome. And the dirtiest secret of all in healthcare, which I'm sure you know, is that the highest quality care is almost always in the bottom quartile of cost. So not only, if you're an employer in the room, not only is it the right thing to do for your humans, it is the right thing to do for your budget. So you get full control of your vendors, your supply chain, you get transparency, you get long-term cost control, you get minimal annual increases except for the occasional shock claim, which is manageable, and you get improved benefits and lower costs. And I think as an employer, they need that now, right? You need it to run your own business. You need a talented workforce, which is harder and harder to get, and you need a competitive advantage. If you can cut your healthcare budget by 10, 20, 30%, that gives you money to use elsewhere. So, all right, I told you I was really bad with technology. In my experience, employers are looking for this ACE. And I think we know that that ACE doesn't exist. I was recently speaking with a woman who owns a fair-sized business. I said, what do you really want? She said, well, I want Signet 50% of the cost. I said, well, you know you can't have that. And she laughed and she said, I know, but you asked me what I wanted. So I would argue that we can do better, much, much, much better today with all of you in this room. We just need to be able to connect you a little bit better with employers who are a little bit more forward-thinking, and we need to teach employees how to maneuver through this system, because I don't know if you've ever been in a room when we've taken somebody's Blue Cross Blue Shield card away. You might think we're killing their children. So, solutions are available now. It is just a matter of connecting the dots. All right, so do we have problems or opportunities? Employers can't afford it. Employees can't afford to use it. We know that. There are a couple of other things that I think we don't think about, though. Change is both more rapid and slower than expected. I think all of you in this room are change agents. I'm one of those clap, clap, change people. Apparently, there are a lot of people that aren't like this. And it takes some time to get them to think about healthcare and purchasing healthcare in a new way. And I have learned the hard way that it is much better to take somebody where they are and make one change at a time. And then all of the changes become easier. So, knowledge base is changing. What I do, what the other brokers in this room do, it is not come shop your renewal, come back with an 18% increase that, oh gee whiz, we negotiated down to 12%, and we're sorry, that's the best we could do. That isn't what we do. It is more labor intensive, it's more thoughtful, and literally we build the bridge as we go sometimes. It's really fun. I got a nod, okay. I'm on the right track. And the moral imperative. And we'll talk about that a little bit later, but I think that might be the biggest challenge that we face. I think sometimes the road looks like this. A little too far to the right, a little too far to the left, you're gonna fall off the mountain. So, providers. Employers are more and more frustrated every day. They don't know what to do, but they know that there's something wrong. Go talk to them. Just talk to people, as many as you can. Employers, there are a few of you in the room. There are solutions in this room and outside of this room that can help you solve your healthcare budget problem today and help people get access to care. And I think that one of the largest problems we have is not just the cost, it's that people cannot afford to use care, right? So they just don't access it. So the small problems become big problems. And then, you know, somebody who has an $80 problem just spent $40,000 of your money in the emergency room, and that's not good for anybody. So, knowledge base and skill sets are changing. What do? Learn. Here, Dave Chase and the Health Rosetta. I heard some conversation about that a little bit earlier. If you don't know who Dave Chase is, go to Amazon and buy every book that he has. He also formed something called the Health Rosetta, which is a resource for both advisors and employers. They have some outstanding resources that are just public-facing documents. One of the things that they have is an advisor compensation disclosure. Best document I've ever seen, open source. If you are an employer, providers too, you have employees, you put this in front of your broker. Marty McCary, we all know. Marshall Allen. Anybody here know Marshall Allen? Marshall Allen is a pastor who turned into a Pulitzer-nominated twice journalist who has blown the lid off of some of the most egregious medical fraud in the United States. He also wrote a book called Never Pay the First Bill. It is the only book I know of for patients. If you want one, I have about 20 more copies in my office. Just let me know. But it is a book for patients. It will teach a patient how to fight a hospital system. I don't think they have to fight you in this room, but patients do fight hospital systems. Marilyn Bartlett, I'm not really impressed with too many people. I am a fangirl of this woman and chased her down for a photo. She took on the hospital systems in the state of Montana, took a bankrupt plan and saved them $30 million over the course of 3 years. She did that after she was 65 years old, and this woman weighs 90 pounds soaking wet. So Google her. She is remarkable, and she does some consulting now. And this woman, Kristen Deacon, ran the Healthplan in the state of New Jersey. You will find her on LinkedIn. She has moved on. She is now a consultant. She saved the New Jersey Healthplan $1 billion over 3 years by moving some of their services from a PPO arrangement to a direct contract arrangement. She knows how to do this. And she speaks very eloquently about it, but the best thing she says is that I will take a fair price over a 99% discount every day. And I think that we have taught people that they need to get the best PPO discount. I don't give a flip about a PPO discount. I want to know what it costs. And good advisors will tell you exactly the same thing. And you want to find those people as a provider because they will connect you to employers. All right, back to that moral imperative. We know that this system is broken, and we know that it's working for a couple of people. It's not working for patients, it's not working for employers, and it's not working for you. So what do? We stop killing people, right? Aligning for Health, which is a pretty reputable source, published an article not too long ago stating that 80 to 90% of every medical dollar goes to a social determinant of health issue, not a medical expense, right? Not medical care. So there are a lot of direct patient care people in this room, I believe. We need you to speak up because you address the social determinant of health issues. And if we can address the social determinant of health issues, we can lower the cost of care, we can lower the $40,000 emergency room visits, we can actually get people what they need. So I would argue that our moral obligation is to do better. We can. Employers want to do better. Lots of employers want to do better. So let's do better. Solutions. Okay. Before I move on to some solutions, I want to point out a few people in the room. So Michelle runs a fabulous clinic. We should support that. And Curtis Lewis and Dr. Ehsan, they do remarkable work. They do a special work, but they do remarkable work. Tim Kaufeld, he is the wires that will connect you to patients. So go talk to him. Dr. Roger has the most creative brain with regard to how to get to employers, certainly in San Antonio and probably in a great swath of Texas. And I know there are more of you here, I just don't know you yet. So I'm going to talk about a few things that we've done. The easiest thing for employers to do is outsource their brand and specialty medications. This is an actual invoice for one of my clients. I don't know that you can see it very well. It's for 4 medications. At this time, the program was voluntary. They saved 85% on 4 medications. When you're talking to employers, talk about pharmacy. It is the easiest thing to address, And once they see how easy it is to address and how little disruption it causes, because this program eliminates the employee cost. So I have a client, the drug isn't on here, but it's called Demista. The health plan charges the employer and the employee about $3,600 a year. It's $50 a month for the employee, and however much that is, $3,300, whatever, for the employer. This alternate sourcing company sourced that for $732 for the year. The employer saved $2,300. The employee saved $600. This particular employee I know, she's a middle-level manager. $50 a month means a lot. Okay, so that's easy, low-hanging fruit. J-code redirection. Most of you know what J-codes are, right? So one of the biggest problems in health plans is drugs that are delivered, they're usually infusion drugs, that are delivered in a hospital system. The hospital will buy the drug, mark it up, bill the health plan, and charge them a facility fee or a treatment fee, right? Because they are injecting the drug. I've already asked Michelle if they would please build an infusion center. So I have a client, this was out of state. There was a chemo drug that I cannot pronounce, I'm not going to, that I know can be sourced for about $1,200 a dose. The health plan was paying $4,000. We changed it, we changed the facility, we talked to the employee. You do have to talk to employees. Brokers don't usually talk to employees, but you have to talk to employees. And there was actually an infusion center that was easier for them to get to. We had the medication drop shipped from the manufacturer, so rather than $4,000, they were paying $1,200. The drug savings was $53,000. Now do that 10 times. It's money. That's actual money. All right, more germane to our conversation this evening. I have a client in San Antonio who has a reference-based pricing plan. We have a member there who got both knees replaced at the same time. I think she's crazy. She thought she was crazy after she did it, but she thought if I do this and I don't do both at the same time, I'm never doing the second one. She might have been right. So the initial conversation with the facility that she chose was, well, we don't have a code for that, so we're going to charge you for two, and it was $37,000, which is a lot less than the national average of $57,000 for one on a PPO network. Then they said, we called back and said, it's one surgery. I know it's two knees. We're happy to pay for two, knees, but do we have to pay full price for two surgeries? And facility fee was reduced to $21,000. The anesthesia fee was negotiated at $2,000, and the physician was about $4,500. About $28,000 in savings on national average. That's real money. The other thing is the employer shares this savings with their employees, so this cost her nothing. And they actually have a decent plan. It's a 4,100% plan, which means that the member has a $4,000 deductible, but then everything else is covered at 100%. So if you're ill or you need a surgery, this is great, right? She didn't pay anything. She was so happy, not after the surgery, but really happy not to pay anything. So these are the kinds of things that can happen when we have a surgical facility that's a cash pay facility, when we have specialists that are cash pay facility, we can do these kinds of things. That puts real money back into the hands of people that don't have a lot, and it helps employers pay more or invest more into their workforce. So I think all around it's a pretty good thing. So, how do you do it? 3 steps. Now, these are employer-facing steps, but I think there's great places for you to insert yourself. An employer needs to understand what's driving their costs. I don't care if you have 2 employees or if you have 500 employees. We can get data now. It isn't free, but it doesn't cost a whole lot, and we can get data. We can get data that is almost as good as transparent TPA self-insured reporting. We can pull it, we can scrape it right out of the EOBs. It's a little bit of an effort, but we can get it. When we get that, we can understand what's driving the cost, because every employer is different. Not every employer is having an MSK issue, not every employer is having a huge population with metabolic syndrome, whatever it is, they're all different, right? so we can figure out what's driving the cost. Then we go looking for people like you, because you deliver the solution. Then we roll it out. I've tried the clap, clap, change method. Nope. Start with something easy and we create a plan, I know there are others that do it too, to roll things out over time so people get a little bit adjusted. I like things like prescription drugs for free first, because then people are like, oh, I didn't have to pay $50 for this or $100 for this. And we got them to take it, because that's also a big problem. Then you layer in things like direct contracting, bundled pricing, no network, reference-based pricing plan. I like direct contracting and bundled pricing better. There's less noise, there's less balance billing, there's less of those kind of problems. I also think it's a much more respectful way to treat a provider. I mean, you can't just say, well, we're not gonna pay for this. We only pay for this and you deal with it. That doesn't work. So I have a guide for that. For providers, it's a little bit the reverse side, but you're welcome to grab it if you like. And the most important thing, go talk to employers. They want to talk to you. Find people who will help you. There's people, in this room that will help you, and keep the conversation going. And as we partner together better, then we will solve this one employer at a time. Questions? All righty.
Thank you, Allison. Well, we have time for a conversation if we want to have one. If we have questions for specific people in the room, this is a very mobile mic, so I can go around, and if anyone has a question for someone or comments, concerns, remarks, don't be shy. Nope. Okay, well, there's time for networking. Dr. Moczygemba and my team, we spend a lot of time and work into setting up these meetings. For next year, we have a goal to, at first, have them every other month, with the ambitious goal to have them every month. We think it is important to foster the network and the community and make us collaborate. So next year, we'll also be looking for some yearly sponsors that will get ongoing exposure through our events. And we would be very grateful if you came to myself and spoke to us about that. Also, if you haven't joined our local FMMA chapter yet, please do so. That is for free. You can sign up at the desk by the door. So the local chapters throughout the nation usually are free to join as a member. And then the parent organization, of course, the FMMA, there's a yearly fee to be an official member. I think it's about $300 a year, so it's not too bad. And you are highly encouraged to also join that. What does that give you? Well, there is a database that gives you access to all the members throughout the nation, vendors, sellers, buyers, everyone who is part of the market. And that is very helpful, right? We also have very powerful annual conferences where the thought leaders of this movement come together once a year. Follow us on social media. Right now, our San Antonio chapter is only on Facebook, but next year will be on LinkedIn as well. We think that's a very important platform. And connect with me on any platform you'd like. Send me a request on LinkedIn. Also, I know Dr. Moczygemba is always happy to connect with all of you. Thank you for attending, and again, don't Yep. Okay. Don't forget that you can spend some time here, enjoy some networking and exchange of ideas. Ms. Adame-Clark, a word for you.
Good evening, everyone. I'm Lucy Adame-Clark. I'm the Bexar County Clerk. I oversee the whole county, 26 municipalities. But I want to say thank you all to each and every one of you because I've been with Bexar County going on 25 years. I started when our insurance was free, and then we started paying $20 when we had Community First, and then we had now we have Aetna, and we've had Aetna for a long time. It's very important that we communicate with each other because now as a county clerk, I have 15 departments that has a probate office that deals with a lot of guardianships when it comes to medical issues within our office. Then I also have the real estate area where you have your GIS map and you have the foreclosures that go through the county clerk's office. If you need anything, I have a mobile unit that goes across Bexar County. Bexar County is huge. We were the first woman ever elected in history, in Bexar County history, so I'm excited about that. Thank you, ladies. Thank you so much. Thank you. That's why we innovated our office, because us women, we think outside the box. Nothing against my men, don't get mad at me. But we do think outside the box and we try to improve technology, but also how can we do better business with each and every one of you. But I want to say thank you so much for the invitation. We're always looking on how to support you, how to support all of you, especially during this pandemic. Each and every one of you really took a hit during this pandemic. We saw y'all, nobody respected a nurse or a doctor as much as they have now. So I even tell my sister, she's a travel nurse and she's been going all across the state of Texas, and I tell her thank you. So thank you for everything you do, and thank you so much for sacrificing your own family for your responsibilities at the hospital, the clinic, and everything else. Thank you so much.
She did that on purpose. I am your constable, Constable Kathryn Brown. Another first, thanks to her. She got me out here on the campaign trail. Thank you. I want to say thank you for inviting me because not only am I a breast cancer survivor, but I'm also an ovarian cancer survivor. So this information that you guys shared with me tonight is very, very helpful. And it's going to be a contributing factor in terms of the people that I speak to and that I correspond with. So thank you so much for this invite. It's been very informative, and I hope you guys have a great evening.
Thank you very much to both of you. I know you will help spread the word, and if our public officials do that, that can only help everyone. Thank you so much. Enjoy the rest of your evening, and goodbye.